been heavily involved in the field since the start. In fact, it was our group in Cambridge back in 2011 that first highlighted the use of circulating microRNAs for germ-cell tumor follow-up. And over that intervening 10 years, ourselves and many other research groups have started showing the sort of amazing clinical utility in terms of the performance characteristics of this microRNA assay. And so over the last year or two, what's been important is to involve patient and publics of representation to talk to patient groups and the public about how this test may alter patient management. And one particular area is that currently there are a whole group of patients with a testicular cancer subtype called seminoma who are marker negative by conventional markers AFP and HCG. And as a result of that, we haven't got a good way of assessing disease response without using multiple or serial CT scans in follow-up. Now, over time, CT scans have improved. The amount of radiation involved in the delivery of a CT scan has reduced. So they are generally safe. But if you can imagine that if you're doing lots of CT scans over time, then there is a small radiation burden associated with that. And there is some evidence that could be associated with an increased second cancer risk from the radiation itself. So anything to try and avoid that would be a benefit. And what we feel is that patients with testicular seminoma in follow-up might be able to have the microRNA test as a simple blood test in follow-up, and then reduce or obviate the need for CT scans in follow-up, and then only do a CT scan if the microRNA level was increasing over time, and in that way save the radiation burden for these patients. And we put that to patient groups. We did a number of workshops, and we published that work in Clinical and Genitourinary Cancer Journal. What that work shows is that the microRNA test, when we put the performance characteristics of the test to patient groups, they were very interested in it. They were very keen to pursue it. There was a lot of issues with CT scans in terms of the extra time that was taken to attend the hospital, the fact it needed a cannula and injection of contrast dye, to which many patients described an uncomfortable feeling, sort of a burning sensation. Some patients who were claustrophobic, who didn't like the, going into the CT scanner itself, and also the delay in waiting for the results and the scan results to go through an MDT meeting to be discussed before being fed back, which sort of created what the patients described as scanxiety, sort of an anxiety around scans. We also commented that this blood test would be taken in addition to the routine AFP and HCG markers. So taken together, the feedback from the workshops was this was something that patients were very keen to embrace, and the work suggested that it would be highly acceptable to patients if rolled out. So that would be the benefits for patients. And in addition, there would be benefits for healthcare systems, which we'd also previously published, that replacing CT scans with the blood test in the US system, our modelling data showed that could save $67 million per year in the US alone. So there's benefits for patients, there's benefits for healthcare systems. So I think circulating microRNA testing for testis cancer will be in clinical practice within the next few years.